discovery that I've made about this beta-caryophyllene. Actually, it's been out there for a long time, but I want to compare and contrast it with cannabidiol, because everybody knows about cannabidiol. Everybody's familiar with it. And you probably have questions about it, or you used it, but one of the connections that beta-caryophyllene offers is many of the same benefits that go along with CBD. And in fact, I think that beta-caryophyllene actually offers some more benefits and further benefits to more extending the cannabidiol and the benefits that it offers. So my background is as a military physician. I went to medical school at the University of Miami. I went to family practice training at Fort Gordon, Georgia, and then I spent 26 years in the Army, and then retired in 1996. And so I've got this 26 years on top of that, doing other jobs since that time. And one of the things that I've learned about since 2014 is cannabinoids. I learned about CBD. I was the medical officer and a medical referral officer for Elixinol, which is a prominent CBD company. And I worked with them for 7 years until I separated from them, and we went our separate ways. And I developed more recently my own company, which is Blair Medical Group. And in that company, we're having a number of different products that we're offering, but they are principally the same thing. They're designed to enhance the endocannabinoid system, the system in our body that is a regulator of all of the other systems that go on with it. So, so with regard to beta-caryophyllene and CBD, I want to compare and contrast what's been going on with it. Now, this is a lady who has regional pain syndrome, and she's got bladder involvement, and she's got a severe disability. Almost looks like just a severe paralysis and restricted motion. And so this is the video of her when she's initially, before she's on any sort of therapy at all. And so she's very, very limited, and she has this bladder bag, and she can't control her urine. It's a tragic situation. She's only 28 years old, and she had this come down with this. Well, that's in contrast to after one day of taking liposomal beta-caryophyllene. And so that's dramatic changes in her in just a single day and a single day of dosing. So I was floored by this kind of result, and I wanted to understand it. And so I've been doing the research on it intensively for months and actually 3 years to learn more about it and what it can do. Let's start off with cannabidiol. What is it? Well, it's an oil from cannabis, and it alleviates pain, inflammation, anxiety, and it controls nerve signals. Well, that's great. It rescues or improves the endocannabinoid system. It bolsters it. It makes it work better, and that's the controlling system in our body that controls all the other systems. So it's really quite valuable. And it's safe, it's legal, it's effective, but it's not FDA approved. Now, the FDA approval is not a big deal normally, but there's certain limitations that come about because of it. And it's fraught with a lot of politics right now about the acceptability of using it. There's also the problem that if you're tested for marijuana or THC, it can show up in anybody who's using CBD because it comes sourced from hemp. But it's healthy. It's very, very healthy and very effective for you. And I want to contrast that with caryophyllene. So caryophyllene is an essential oil that's common in many spices that alleviates pain, inflammation, anxiety, and metabolic disorders. Well, that sounds very, very similar. The pain, the inflammation, and the anxiety, sounds like what CBD does. And it is what CBD does. Now, in particular, we found this particular molecule is found in thousands of plants. It's found in many of the herbs that we take in, like cinnamon, like oregano, like hops, basil. These are all things that contain a significant amount of caryophyllene, but we just don't get enough. We don't get enough of these herbs, and we don't get enough in our diet. And this particular, the delivery system is very, very important. And there's high concentrations in 36 species, and I mean high concentrations, it's anywhere between 30, 40, 50% of the oils from these plants will contain caryophyllene. So it's very, very prominent in some plants, in particular hops and hemp, but it's just not been recognized. It's not been recognized for its true value. Technically it's a terpene, and a terpene is something that has a strong odor, and that's what we smell when we smell spices. We smell cloves. That has significant amount of beta-caryophyllene in it, and other spices. Then these are terpenes that come in. And it's also what plants use it to communicate with other plants, because they send off the aroma of these terpenes to signal the other plants and tell them there's danger around, or to act as an anti-insecticide for different things. And so it's amazing utility within the world and within nature, and we've just not realized the potential for it. There's actually 2,900 articles in medical literature on caryophyllene. And they've been begging for more literature and more experimentations since 2008, but that hasn't happened. There's very, very limited medical literature, clinical studies that have been done on caryophyllene, which is a terrific disappointment. So BCP is FDA approved. It's approved as a food flavoring, and it can be used widely, and it can be put into almost any other food as a flavoring, and the quantity that are in most products is really minor, so that and in these products that I'm offering, it really amounts to only about 5%. So it's not a huge amount, and it has these particular benefits, and it gets beyond the barriers of the FDA and the legal constraints that we have for it. Whereas CBD is not approved by the FDA, and this restrictions that we talked about earlier. Now, how does BCP and CBD work? Well, I'm not going to bore you with all the detailed connections, but these are the connections that are typical for beta-caryophyllene and for CBD. These encompass cytokines, and these are these inflammatory substances that are released by immune cells. And these CBD and THC, CBD and BCP signal the immune cells to release these things. There's enzymes, there's genes, there's signaling molecules, there's transcription factors, adhesion molecules, chemokines. Those are other chemicals that will induce inflammation. There's cell cycle proteins, and there's signaling pathways and receptors. These are all mechanisms that are encompassed in CBD and BCP, and in fact, they're very, very parallel, which is a surprising thing. There's a few exceptions, but for the most part, they're parallel in their connections. So what is the difference? How can these two substances, how come they're not equal? And why, and what are the differences that occur? Well, it turns out that some of the differences have to do with how strongly they connect with these receptors and how vigorously connected with the receptors. And there's different levels of connections that occur with them. So there is a different format and a different emphasis on different conditions that these two products are effective for. So what I've done here is try to list from a clinical standpoint what generally CBD is really good for and what BCP is really good for. And I've tried to define these very carefully, and I've tried to put the strong points in for the different benefits. Now, CBD, definitely epilepsy. We know we've got clinical studies, and we've got lots of research, and we've got a pharmaceutical product that's out for epilepsy called Epidiolex, and it's very effective for epilepsy. And we know that there's plenty of research done on it. So there's over 5,000 or 6,000 articles that have been written about CBD. And at least I think a third of them have been done about epilepsy. But there's also Parkinson's and Alzheimer's disease. We know it's effective for these things. And there's constant clinical studies and reports. It's effective for brain injury and wound healing and cancer. We know these things, and we want to emphasize their selection of CBD in these cases. Now, mainly it's working as a neurotransmitter modulator. So if there's too much of a neurotransmitter that's getting us overexcited, then this calms it down and evens it out, and it reduces inflammation as well. So it's a combination factor that is really beneficial. Now, on the other side, beta-caryophyllene is an immune, it works on the immune system and the metabolic system. And this is kind of the gears of the body, and the functioning of the body in big time occurs with this. So what I've seen with BCP is that it's particularly effective in neuropathic pain, that pain that comes from nerves, let's say a pinched nerve or an irritated nerve. It's particularly effective for neuropathy. And for vision, this is phenomenal for vision. Visual improvements all across the board. That means improvements in the retina, and glaucoma, and maybe even cataracts. And for depression, this stellar for depression. It induces immediate relief of depression. Gut issues, and that means constipation, diarrhea, chronic pain, gallbladder pain, all kinds of things, irritable bowel, and inflammatory bowel, and allergy. One of the most recent studies, one of the most recent things I've learned is it's very effective for mast cell activation syndrome. So if you have an anaphylactic reaction, or if you have a severe allergic reaction, mast cells are activated and they produce histamine, and they cause itching, and they cause burning, and they cause all kinds of symptoms. Well, there are people who have a mast cell disorder that causes a release of that chronically, and they are chronically exposed to this mast cell itching and inflammatory substances that are released from the mast cell, and they're constantly exposed to this, and it causes terrific symptoms. What I've seen with BCP is it relieves it. Weight loss, can you believe it? Weight loss, I've got documentation on that. And diabetes and cholesterol and addiction. And that includes food addiction as well as substance addiction. Now the negatives, for BCP, it's taste. And there are some headaches that are associated with it. There can be some diarrhea, but it requires some selective, it's individualized in terms of that. But the negatives for CBD are mainly drug testing positive. There's dryness and there's increased eye pressure, so it's not very effective for glaucoma. It can produce an anxiety in people. Actually, it relieves anxiety in most people, but it can actually cause anxiety in some people. So it's kind of an inverse reaction, and it may be dose related, but it's hard to say. And some people actually feel high from it, and it's peculiar, but for a substance that doesn't contain THC, they will still get a high feeling. Now, how do you define that? That's difficult to really define, but that does occur. So let's talk about neuropathy and nerve pain. So one of the things that BCP does is it particularly works on the microglia and the nerves and the supporting immune cells that support the nerve cells. And so that's the microglia and astrocytes, and these are supporting structures that really are protecting the immune cell and feeding the immune cell and giving it nutrients. And when these get inflamed, then they can produce quite a bit of neuropathic pain. There's also neuroinflammation, such as Alzheimer's disease and brain inflammation. It causes depression, it causes anxiety, many of these things, and it causes, and there's associations with brain trauma, and other neurodegenerative diseases are also associated with it. And then there are a number of course, you've got the Alzheimer's effect. So CBD works at the cannabinoid type 2 receptor, and it signals all the immune cells to calm down, stop inflammation. And it also connects with the CB2 receptor that regulates the synapses at nerve cells. So it calms down the vigorous reactions that are occurring in those nerve cells. So it causes a relaxation, a calmness, and it alleviates so much of this inflammation. Pain, anxiety, depression are all mitigated by this. So I bring up this case, and I want to bring case studies up to you. I want to show you what it can do. And this is a gentleman who is 60-year-old. He had bilateral arm amputations from a power line rescue of his father. And he's 60 now, and he's played golf. He's almost professionally. He's a vigorous guy, but he has constant pain. He's got pain in his stumps. It's phantom pain, and it's constant pain from the folds of skin that have been placed over there, but he's faced with that. He used the BCP gel on his arms, and it's the first time, and it's the only time, that he's ever had relief of his pain. Now he uses narcotics, or he has used narcotics. He doesn't use them now, but narcotics don't really relieve the pain. And so he's limited in terms of dosing of that. And this is the only thing that has really worked for him. So I want to get into the eye issues. And the eye issues are fantastic. They're fabulous. Now, what I've done is that the retina is so sensitive to inflammation. And I've listed off 8 different inflammatory molecules and signaling molecules that go into the eye, and they cause inflammation. They cause macular degeneration, and they cause also diabetic retinopathy. And there are a number of other problems. Even glaucoma fits into this. But these 8 categories, BCP signals and stops the inflammation in the eye. And I've got an example of one case that I've got several cases, but this one case was of a 40-year-old lawyer, type 1 diabetic, who had a complication of his eye, and he did retinopathy related to an allergic reaction to his infection, and he had diabetic retinopathy as well. CBD made some improvement, but it was limited. He used BCP for 4 months, and his scan normalized. And he went from this severe compromise down to normal with his vision. An incredible result from this, and nobody has ever seen any of this before that it's had this corrective factor. And it's been effective for macular degeneration and for diabetic retinopathy, and it would be effective for other types of retinopathies as well. And I've also experimented with glaucoma, and I've had good success with glaucoma, and there's some suggestion that it would be effective in cataracts as well. Now, depression. You know, the depression, the cycle of depression, we've got a chronic depression going on right now. So many people are exposed to depression at this present time. And it's probably stress related. And it's in the stress, this chronic stress leads to inflammation and inflammatory molecules. And they get into the brain, and that causes anxiety, and then it causes depression. And there's different ways to treat it. There's different approaches to it. You can use relaxation, there's socialization measures, and there's proper sleep. And there are hormones that are connecting up to this depression. And there's cortisol and adrenaline. And there's inflammation. And the inflammation is what I'm keying on, because these correcting this is a calming down of inflammation. And the cytokines are so much increased in depression that if we could correct these, this would be great. Now, what we see with BCP is that it corrects this immediately. It corrects the inflammatory depression immediately. And within 10 minutes, we get a resolution. So I've got these stories that I've listed off. And this was from, the first story is from a naturopath who reported that he had a patient, a 50-year-old woman, struggling with anxiety and depression over her entire adult life. She used CBD before and had negative results, but one drop, just one drop of BCP, she was smiling and beaming, introduced herself to unknown people, and BCP was going to change her life. And I got these thanks for it. Now, another case was that I was talking to the patient, and I noticed that she had improved her outlook, and I asked her what had happened. She said, you hit the nail on the head. The release of depression was almost immediate, as well as the ache and stiffness, which is subsiding. Totally miraculous. The black cloud upon me is lifting. I feel like I've been to hell and back. And that was just the first few doses, and it's this conversion that happens with it. Now, I'm so surprised. I would have never expected this sort of thing to happen, but it's happening repeatedly. Another case, truthful, exclamation mark, good stuff, got me out of a severe grief-filled depression in nanoseconds, and I was sinking fast. The stories go on like this. And then Nell, a 53-year-old psych nurse with anxiety, depression, PTSD, 5 drops, had immediate relief of symptoms, restoration of confidence, well-being, an outgoing personality, including stage presence. This is so phenomenal, and that's what my team is so excited about, because we're seeing these transitions in so many people. It doesn't happen in everybody, but it's happening in about 75% of people. And so I just am really excited to bring this information to you. Gut inflammation. So BCP has a particular area of target on the gut, and this is unique. It doesn't happen with CBD. You get this relief of gut pain, and probably through gut inflammation, and some vascular changes as well, because it affects both those systems and the metabolism. So what I've seen with it in practice is that there was a first case was a autism child who was having abnormal stools. He was constipated, had a huge diameter, undigested food particles, and that was reversed. He became normal within 10 days of using it. So it corrects for these particular problems. In addition, he was happy, he was better socialization, improved speech, and normal stool. Wow, it's incredible. I would never expected this sort of thing to happen when I first started on this. Then another patient she had a gastric ulcer with H. pylori infection, and she was using multiple antibiotics to get rid of it, but she still had symptoms. And she had gut pain, liquid stools, and just all kinds of problems with it. Well, the BCP sample got her bowel movements normalized, gut pain relieved, improved mood, relief of anxiety and depression, all within a few days, within the first dose. Amazing. I can't even fathom that that benefit occurring so quickly, and yet it does. It does repeatedly. And then KJ. Since I ran out of BCP, I feel more inflammation overall. I've noticed it mostly in my GI tract and after allergies, mast cell issues. So we see that when she runs out, you go back to the way you were. And so that's important to know that it is a BCP that's doing it. And then an AO, the 57-year-old with diarrhea, non-alcoholic fatty liver disease, gallbladder inflammation, obesity, depression, menopausal brain fog, all these things. She took 3 milliliters and had improved mental vision, mental health, and vision, relieved her gallbladder pain, stopped her diarrhea, and almost immediate depression relief. So there's the combination, depression and the gut pain and the diarrhea. And I've seen it actually produced, the autism child was having constipation, and he got loose stool. He got normalized stools. And this lady's having diarrhea, and it corrected that. It's an adaptogen. It works on what needs to happen. It corrects to normal. It doesn't cause an extreme of any type of reaction. It just corrects to normal. And then the final case here, I've got the LBC, as the liposomal beta-caryophyllene, is working fine for me. I take 5 drops every night before I go to bed to relieve gallbladder pain that was bothering me for months. Incredible. I've never seen anything like this to relieve gallbladder pain, and this is so unique. I'm flabbergasted that it happens. Now, I talked a little bit about mast cell activation syndrome, but this deals with allergies, and the mast cell is the center and the focus of almost all allergies. And so these type of symptoms are common with people with mast cell activation. You may know somebody like this, and they may not have a diagnosis because it is not commonly diagnosed. It's a syndrome, and so it's very difficult to get this diagnosis and get it clarified. But if they're having many of these things, then they could have mast cell disease, mast cell activation. Now, it's not a malignancy, it's just an overactivation of mast cells that are occurring, and we don't know enough about it yet to figure out what's going on and why it's happening. Now, this particular study is important because beta-caryophyllene dose dependently, and that's important, and that means it has a direct effect, and it's correlates with the amount of that you take of it, and that indicates that it's it's probably therapeutic for it in the right dose. It inhibited systemic and cutaneous anaphylactic-like shock and mast cell degranulation. It inhibited anaphylaxis. That is the ultimate in allergic reaction, is where you have the asthma and you get vascular collapse, and it stopped it in these animals. And so really, really impressive. And it has to do with particular action of beta-caryophyllene on mast cells. It's just stupendous in that. So I've got these case studies, with the first one is, I've actually had 7 patients with mast cell disease that I've treated in the last month. And I've never treated it before, but I've treated it this time. I was referred a patient remotely from another practitioner who said he had a problem and he thought I might be able to help him. He was a 50-year-old optometrist, and he was struck by this illness, and he had a positive diagnosis, got him on it, and he reversed his symptoms immediately with it. And that's what happens. Each of these cases is an immediate response. So the number 1 here is the BCP plus, is still reducing my anxiety and improving sleep remarkably well. Stomach is much improved and depression is lifted, but not all. Then I wouldn't expect that. And then the next case, there's a panic that sets in with mast cell attack. You don't know how bad it'll get. You don't know how hard it will be to breathe. You itch in your throat, your chest, so badly you want to scratch your skin off. BCP let me have much more minor attack this morning, minus the panic, and my digestive pain completely disappeared. And the next one, I had mast cell activation syndrome. Now, this is a patient that I've been treating for 4 years with beta-caryophyllene, but I didn't know it. I didn't know that she had this syndrome until recently. She fired back at me as I released this information about these patients that I've been addressing with it. She found out, she realized that she had mast cell disease, and she's treated it, but she didn't know why it was getting better. And so she comments here that she is going to the doctor for follow-up, and he was shocked that I had been not been experiencing any symptoms, and my labs have all come back excellent. And that just goes to show you how well BCP works. I couldn't ask for a better testimonial than that. And then the patient given BCP, this was from a doctor, Dr. Cost, who's a medical director of a Hartford hospital pain treatment center in Hartford, Connecticut. And he talks about a patient that he was gave BCP 2 months ago, who had a hypermobile Ehlers-Danlos syndrome, which is that, you have people that have hyperflexibility and hypermobility. That is Ehlers-Danlos syndrome, and that is a problem because most of those people actually have association with mast cell activation syndrome. So there's a strong correlation, and there's a lot of pain with it. So he found that this patient who was exposed to beta-caryophyllene, she has had dramatic improvement of all her symptoms, and it has changed her life. So there's this thrilling and exciting prospects that this could correct for so many different things. Now, CBD will help control allergic phenomena, but not to this degree, not anywhere to this degree. What about diabetes? Now, diabetes, it actually is effective for calming down all aspects of diabetes, from the inflammation, from the glucose, the secretion, from taking the glucose out of the blood system and getting it into the muscle cells. It improves the circulation there. It prevents, it actually increases the insulin production in the body. And it protects against inflammation in the eye, in the liver, and it actually, in the small intestines, it blocks the glucose uptake in the gut. So I had patients who have reported that they have dropped 2 points in their A1C as a result of using BCP. And it also affects atherosclerosis, which is a common problem with diabetes and the inflammatory products. And it actually lowers cholesterol. It lowers cholesterol. And in this one gentleman, it lowered his cholesterol 60 points as a result of using BCP. And this weight loss is a surprising finding. That I knew that beta-caryophyllene had decreased the food cravings. I knew that it had improved the energy and the mitochondrial performance in the body, but I didn't have real evidence that it was improving the weight loss. And I've gathered that evidence, and I've been honing down on that more recently because of the dramatic benefit that people could achieve with this substance. Because it's not something you don't recognize it, because it's turning off your cravings for food, and it's turning off your food addiction. It's turning on your energy, it's turning on your mitochondria, and it's changing the lipid profile of your body. So it's actually preventing the laying down of fat, and it actually decreases the amount of visceral fat that is being laid down in the body. So the outcome is that people will lose weight, but they will gain muscle with it as well. And this is one of my patients who lost 45 pounds, and she's going to a physical therapy, and she's going to get back into shape, and she feel good for once in my life. Honestly, 90% better. So there's this dramatic changes that occur physiologically in the metabolism and the energy cycles of the body, as well as the psychology. So it's something that could be inherent in all of us, to feel this activation, that we could all benefit from this stuff. And then earlier on, I've got the first report is that after 10 days, I lost 12 pounds. I was 279 and now 267. I feel my relationship with food is different also, and less binging and craving oriented, more closely health related. So it's been easier to follow a healthy diet. And then the second one is that the liposomal formula really has improved the ongoing pain issues, and there are no side effects. I've lost 13 pounds, and I'm only 5'1" and about 115 pounds. Even my PT remarked that my muscles are strong. So it's not only the weight loss, it's a fat loss that's occurring. It's not an overall weight loss. It's targeted for fat loss and building muscle in that case. So this is the other area that is very, very promising, is that this beta-caryophyllene has the potential of blocking all addictions, no matter where it's coming from, because it focuses on the addiction centers of the brain, and it modifies the reactions that we're having. So that means that it's effective on opioids, cocaine, nicotine, methamphetamine, alcohol, benzodiazepines, THC, and food allergies. And you probably throw in some others that are going on, but it blocks all of those receptors. And so it's amazing what the potential is. This ought to be on that $17 billion that we ought to be using for opioid intervention as a possible substance. Now the stories that I've got from it are, I've related to THC and CBD, and I want to make a BCP comparison here, that each of these patients, typically people are using CBD also, and they are not meeting their particular needs. They're not getting the relief that they need, or they are having some side effects from taking a THC, and so they have difficulty with it. Well, BCP has corrected that in so many cases. And the other comment here, PL said that she had extremely tranquil mind, like 1,000 times what a CBD supplement would do for her anxiety. I feel well-being, I feel happy, motivated. It's a better euphoria than any CBD I've taken. Now, I don't know what she means by euphoria. I don't think it means a high. It just means that she has a feeling of well-being, and that's what she's talking about. And then BCP versus CBD. Feels like an uptick in overall well-being is quicker and more noticeable than BCP, with BCP. And also, love the consistency of the fluid, and the taste is so much better than CBD. I'm a fan. Everyone needs BCP. And finally, I don't usually notice CBD. She doesn't feel it. She doesn't sense it. But I do notice it when I take BCP, and increasing my omega-3s, I have dramatic pain relief in my joints. So these people are exceptionalizing the BCP. Now they're also using CBD. You can use it, and I want to emphasize that you can use them together. In fact, the benefits are additive, and there's a huge amount of synergy that occurs with using CBD and BCP, but you don't have to use it. And the synergy occurs with pain, with sleep, inflammation, epilepsy, autism, dementia, stroke, and cancer. The combinations are particularly effective. So if you don't get relief with one or the other, you can add the opposite or the companion and get the additional benefits that you're really seeking. Or you can isolate and use one or the other. So there's huge potential for this. You know that BCP is actually found in hemp, but it varies in the amount that you get with a CBD dose. And so sometimes that's variability, and the delivery system is very important for that. And so what we've done is put it into a liposomal form that gives it a much better bioavailability. So this is the effects of cannabidiol and caryophyllene alone and in combination. And you see the smallest lesion was this combination up here in the far right, where the smallest lesion and the smallest result of ischemia was felt in the combination of these two substances. That gives great credence to the benefits of using both of them. And there's countless other studies that show this is true as well, as particularly in cancer. So beta-caryophyllene has huge potential in all of these conditions. It has evidence that supports it, but we don't have clinical evidence. There's too few clinical studies that have been done on it. I've got 2 that are planned, and one is a neuropathy examination, and the other one is a dental evaluation in Australia, and the third is osteoarthritis study also out of Australia. And I'm developing one with Dr. Cost for Ehlers-Danlos syndrome and mast cell activation syndrome, because it would be really instrumental if we could evaluate this and get an objective evidence. I've had researchers, and I've told some of the prominent people in this area about it, and they say, I want to see the research, I want to see the research, and they will not make any move about endorsing or using the products until they have the research in their hands. So this is a summary slide, and I want to get the beta-caryophyllene is a natural herbal food substance. It's in our diet all the time. We just take in varying amounts. It's a broad spectrum cannabinoid, so it's working on the endocannabinoid system very, very effectively. And it's FDA approved, accepted, it's low dosing, and has no significant adverse effects, and it's synergistic with CBD, and it's an alternative product to a cannabis product. An alternative product in that the people who have to get tested and are wary about getting tested, that would become a problem for them. This can be used. So that means police, that means military, means CDL drivers, means lots of medical personnel, people who are prisoners or on parole. It's a whole list of people that this would be ideal for, at least for getting them started on an effective analgesic program and a mental health program. And its established effectiveness of a liposomal technique could be very, very effective. Now, what we've done is we put together several products that are formulated with BCP. We have the liposomal blend, which is the oral one that you've all tasted. It's got a sort of a sweet taste to it. It's thick, and it has these effects are best felt sublingually, but they're immediate effects that go on with it. And then I've got the topical gel, which is a topical formulation, slightly different, but it has magnificent properties for taking care of pain, but also for as a serum for correcting for skin lesions and skin texture issues. So it's actually been used to enhance the thickness of the skin and improve the skin quality and moisturization. And then I've got the topical oil, which is the essential oil that is a concentrate that can be used in dropper form. It's very intense, but it can be used on different types of lesions like nail fungus, or it can be used on the skin, and you can get lots of benefits from that as well. And then we've got crunches, which are delicious small cookies that are taken in. They have 9 milligrams of BCP in them, and they give a good dose for BCP, and it's a tasty little treat. It's also good for animals. The dogs love them, and they have remarkable changes with them. And they're good for kids too. And there's no reason why these products cannot be used for children. There's no contraindication whatsoever. And these low dose approaches are excellent for the use, and you can get magnificent changes with kids from it. So this is a liposomal. It gives different ingredients. Now, when you're using liposomal, we start with a 0.5 milliliter or 15 drops. Every drop is 1 milligram. And so we usually start with 10 or 15 drops. If you're a particularly sensitive person, you might start with smaller. As you read there in the examples, I had one person take 1 or 2 drops, and they got full benefits. Well, that makes the product pretty conservative. Since there's 60 milliliters in the bottle, that's going to last a long time if you're just using a few drops. But I instruct everybody to use as much as necessary to optimize their performance. And that's the idea, is that you want to make yourself do the best you can. And there's no toxicity, no side effects. And so you want to control for the inflammatory signals and the pain that you have and the anxiety, and you use it as you need to control it. Now, generally it's twice a day, like half a milliliter twice a day, is very beneficial. But you may need to go 1 or 2 milliliters if you have severe problems, or it may be just for a particular time. And then I've got the gel. It hits on 3 categories. The Rejuvenator Serum, it reduces wrinkles and it improves neck sagging skin, but it also works as an anti-inflammatory, particularly on bites or stings or burns, and it also relieves pain and mobilizes joints. So you put this on the joint, and if it's a joint that's stiff, then you'll see it mobilize. You get about 20% more mobilization with it. Well, that's what I've got for you. That's what I've want to talk to you about. I hope you understand. I hope I've related the contrast and compared that CBD is quite valuable, but BCP also has value, and you can now have a choice of what you're going to target a particular symptom with, and decide which one you want to go with, and you can. There's awfully lots of benefits for using both and using them individually. So thank you very much for listening. Did anybody get any response or reaction from your dose? No?
Well, I didn't have one today, but I have had some very positive with mine. I just had full dental implants, and Christina suggested that I try it, and it seems to be helping.
Excellent.
So I'm almost 2 months into it, and I have a space that's not clearing up, and it seems to be helping. So.
Oh, excellent.
It's a good
very
thing.
Good, yeah. So the typical symptoms that I see, I have people do a self-sampling, a self-assessment, and I check for, I ask them if they have the pain or numbness, anxiety or worry, and I ask them to check their vision and their senses, and then check their muscle tension, also enhance strength and energy. And then cognitive factors and memory and mental clarity, and then speech patterns are often affected by it in a positive way. And then the behavior. There's an overall feeling of well-being when you get an adequate dose of BCP. And then stomach and intestines relieves cramping and relieves pain and constipation and diarrhea. And I ask people to do that before they take a sample, and then wait 10 minutes and reassess themselves in that process. And so I get about 90% of people get a positive response. But if you don't get a positive response in 10 minutes, take another dose and adjust it and titrate it to what your need is and what the benefits are, and try to target that. And you might even increase it again by another half a milliliter to find out what the dose is that's highly effective. Well, great. What questions do you have?
I have questions in a bunch of areas. Is mast cell activation the same as mastocytosis? I think it's right.
No.
Because those are 2 different diseases.
No, mastocytosis is a proliferation of mast cells, but it doesn't necessarily relate to mast cell activation syndrome. That's right. So it's different.
So would that help suppress the mast cell release though from that, or?
I feel certainly would. That makes sense that it would. So the BCP actually affects all of the immune cells and the release of immune cells, so that if there is a release of immune cells and mast cells, then it would quiet all that release. What it does is it targets immune cells, and it shifts the metabolism of the immune cells from one of activation and attack and defense to one of more resolution. So you go from an attack and prevention and virus and inflammatory lesions to one of resolution and calming and healing particular wounds. And that's what it would get to. So that would be very effective for mastocytosis.
So I'm asking, that's for a family member, so are you looking to enroll people into a study, is that what you said? Or
I don't have that capability, but I would love to be able to talk to them
To
and
enroll,
to
okay.
get the N of 1 case study.
Gotcha, okay. And then with the macular degeneration,
Yeah.
we know somebody else that's dealing with that, it's genetic, I guess.
Well, it's macular degeneration maybe have genetic potential, but it all has to do with inflammatory pathways. And so it's one of those 8 inflammatory pathways is keyed in for him or her, and they could be calmed down with BCP. Now they're going to have to take it for a month to 2 months before they're going to recognize the changes in it, but it will document, and they'll typically have immediate changes in vision with the dosing of it. So if they got checked right away, they can identify improved light, improved color, improved definition, and improved relaxation of the eyes.
So if somebody's interested in it, we should just give them a bottle of it and have them start on, and then, should they come see you first if they're locally, or should they, just start on it?
Well, I think they could just start on it. They can start on EZU, but if they don't get the response they're checking, they're expecting, then they can talk to me.
Good.
And I have also have white papers that I've done on the topic, and I can pass.
Yeah,
them.
I found one of those on your Facebook, I think I read most of it.
So I produce the white papers, I produce topics, and I produce a short 1-page or 2-page elaboration on the science of the topic and the disease and how beta-caryophyllene would impact those. And so I've done that with eye disease and retinopathy and many other conditions as well.
So most of the stuff, I mean, it's all anecdotal right now that you're presenting us.
Yeah.
That's the one problem I see with
That's right.
the science.
But it's a food. It's a natural food, so there's no risk.
Yeah, the downside's pretty small.
Yeah. And there's samples available, so if you want to check it out, you can buy a sample and sample it and see if you get the benefits that I am telling people about. And if you're one of the 75%, well, great, you can take off on it and you can get additional bottles and change your life.
One last question, this one's for me. With the neuropathy, I don't deal with pain, but I have numbness and a very enormous loss of feeling in my feet. And it may be neurological, physical neurological impingement, or it might be whatever else is causing it.
I don't have really strong experience in neuropathy, in that type of anesthesia, neuropathy, but it has worked. It has been effective in a number of cases, so that's a possibility. And you would know it really from
Pretty quickly.
Okay.
And what about sinuses? Has anyone done anything on sinus infections or anything like that? Any inflammation?
No, but if you use it, if you use BCP, you immediately clear the airways. So you have relaxation of the airways, improved breathing. So if there's any allergic phenomena or congestion, then it generally clears that airway. And you can use it on your nose. Put a drop on either side of your nose. It typically clears the airways, and you have to be breathing much more thoroughly. Now, it's also antibacterial, antifungal, and antiviral. So it's a superb compound that you could correct for a number of different problems. And it actually blocks biofilm. So biofilms form when bacteria or Lyme disease, they create an encasement that protects them from the body, from the inflammatory and white blood cells and antibiotics. And then these biofilms harbor the bacteria, and you can't get rid of them. And that's one of the things that BCP does, is break up that biofilm. So it's marvelous for dental disease, and in that it breaks up biofilm. It kills the bacteria that promote dental disease, and it also acts as an anti-inflammatory. So for sinus disease, I theorize that it would be very, very good
How would you apply it then? Because
Would you,
with that
yeah, I was
application.
wondering, are you gonna can you nasal rinse with that, or?
I would take it orally, and then I would put a couple drops on the nose. But my emphasis is gonna be on oral dosing.
And what about abscess teeth? Has anyone had it help an abscess?
I haven't got the case study on it, but it would be very, very effective. It would reduce inflammation, and it would reduce infection, and it would take care of the pain. So and it improves healing too. So it actually advances healing. It has been shown to actually increase the number of stem cells converting to epithelial cells. So there's that stem cell stimulation that goes on with it as well.
Dentists are already using clove oil, so I can just imagine this being more focused.
Yeah, I think so, and less irritating than clove oil.
Yeah.
Thank you.
You bet.
So I get migraines with aura, so I take a CBD gummy once a day, and right now we changed it to hemp gummies we just changed it. But anyway, and then if I do get another migraine, then I take another CBD gummy, and then I've got some of the liquid that the BCP that I put like on the bridge of my nose and underneath here. And that usually, shortens the amount of time that I get a migraine, so.
Wow,
Yeah.
that's great. So you're using a combination approach.
Combination
That's excellent.
approach, yeah.
Mhm. I've had it happen both ways. I've had people who have had severe migraines that wasn't controlled with BCP, add on CBD and correct it.
Mhm.
And I've had people who have been using CBD and they have headaches and they can't get rid of them, they use BCP and then they get rid of it. So sometimes a combination is
Yeah.
what you need.
Yeah,
Yeah, good for you.
yeah, thank God.
You said there were different ways of taking the BCP.
You
Would
can
be
take
getting
it
the
topically, or you can take it orally.
Would you be
or-
getting the same benefits, like for say if you used the lotion? Would you be getting the same benefits if you like took it orally, or like?
No. So if you use the pure tincture, you can get many of the benefits that if you use it orally. If you use the gel, you're gonna get that mostly localized. Now, there are some systemic benefits, but they're not as elaborate. I have had people tell me that they felt a relaxation over their whole body after, or the region of the body after using it. So I'm sure it's there. Now, the gel actually combines 3 terpenes that work as a endocannabinoid enhancing and signaling molecule. So it's a little bit different than the other BCPs, but it has dramatic effectiveness in many conditions. I don't know everything. I don't know how people are gonna respond. Some people are extremely sensitive to using it, some people are very resistant and they don't feel anything. So there's a wide variation of response. Now that's true for cannabidiol too. There's just a wide variation about what people use and what people benefits from a dose. And so it's the same thing with beta-caryophyllene. There's a wide variation, and I don't try to pinpoint it. I try to give an average dose and recommendation, but then to open it up, and I want you to decide from optimizing the benefits that you receive from it and however you do it.
My daughter she's 18 now, and she has, you'll know what it is, I can't remember the name of it, but what's an internal thing that they get with part of their menstrual cycle, but she gets those rosy butterfly looking wings on her cheeks. I forget what it's called. There's a name for that.
Rosacea.
No, it's not rosacea. There's another one. I got you. But she has a lot of trouble when her cycle comes in, and I was wondering if the BCP would help. I was noticing some of the organs and things that it was showing that it would help like minimize the trauma that she experiences during her menstrual cycle. If that would be something.
Yes, it has the direct effects on the on estrogen. It actually they're vague. but it has improved people's menstrual cycles directly.
Right.
It has improved the pain dramatically
Okay.
for pain, for that symptom. It's particularly effective for endometriosis,
Okay.
and it is effective for menopause. But I'm vague on the other things. I just haven't had that many cases of people reporting on it.
One more question. I had a little more aggressive thing. Just about 2 weeks ago, I cut this finger almost completely off with a chainsaw. Had an accident, and no insurance, so I just kind of repaired it myself. And so I'm wondering, because I have movement down and I have feeling all around, the return tendons are gonna take a while. That gel, so that I can function, because like if you tap it, it's beyond imagination what the pain is like. It just shuts you off. And so, does that stuff help with like that kind of healing and pain too?
You know, it helps with an amputation.
I missed the amputation. I kind of wish I wouldn't have missed it.
Well, I gave an example of a man who
I was in the restroom. I think, what
a
happened.
man who had bilateral upper arm amputations.
Oh no, the golfer.
Yeah,
Yeah. Okay. Sure.
it's very effective for that.
Okay.
For the pain
Cool.
that is
Yeah,
essential.
I'll be cashing in on that for sure. 'Cause it's
You
kinda-
you really need to try some. You
yeah.
can use the liposomal on that right now, and you can get substantial relief.
Oh yeah.
Take some drops.
Yeah.
Misty will
Oh,
give
just
you-
the drops actually.
You
Yeah,
can
just
you
for
can
a
get tremendous
couple of
relief.
drops.
with
Oh, on
the
there?
drops. Yeah.
Oh, I didn't know that. Okay, cool.
So the oral product can be used topically. It's
I didn't
absorbed
know that.
really well.
I didn't know that.
I didn't tell you.
We're fighting through. We got the infection dialed, but the pain control's a little on, and I don't do
Misty, would you help him?
opioid. I can't. Yeah, I need a big, strong arm. Got no grip. So thank you, Misty.
But I suspect within 5 minutes you're going to feel a dramatic.
Let's use me for a guinea pig. Let's see what
Okay.
happens.
Let's see.
Exactly. This is really cool. I spent almost 15 years on disability for nerves, for mental illness, and took so much medicine that it nearly killed me. And then we had no choice, and the doctor says, well, you're not gonna take medicine no more, because you're just gonna
You
kill
only need a couple drops.
Okay. Is that a couple drops? Is that a couple drops?
You,
Yeah,
you
that's a
put
couple
about
drops,
8
that's good.
on.
I mean, anything less than 10's a couple. Okay, well, we just wanna make sure. Okay, cool. But, yeah, so it's really awesome to see people that get it, because we're stuck so much in society with what's
You
crammed
know,
into our
the
heads.
drugs that they have for mental illness are so toxic.
They're gnarly, man, yeah.
They help a number of people, but there are such toxicity if you have to use them long term. And they keep getting add-ons and add-ons
Yeah,
and
it's pretty
add-ons.
scary.
And they
Yeah.
don't have the huge benefits that come with them.
Well, and part of the problem too is they don't push anymore for people to get a counselor that can help you figure out what's really wrong. They just keep cramming dope down your throat, so it's kind of sad. But we're beyond that. We're beyond that. So we're doing natural stuff.
We
now.
know that antidepressants have a long-term adverse quality to them. And
liver
there's so
takes
many of the
pretty
other
good.
substances also, the antipsychotics, there's long-term problems
There is.
with
Yeah.
those.
My
Do you have something on your other hand that comes?
Oh, I don't. It's all good. Just dirt. No, this one. I want to see what this one does.
I
Pretty
don't
soon I'll
think
be
people
over here. Yeah,
really-
really cool.
I'm sorry.
Thank you.
Allergies, I think,
Cool.
but
Smells good.
don't realize
Smells better than it
just what
did,
you
for
said
sure.
about the toxicity of so many different medications, especially, well, I have MS, I have fibromyalgia, so they throw things at you. And I spent 3 weeks in the hospital about 5 years ago. And it was because of all the drugs. There were just so many.
Well, so many
Yeah.
physicians have turned into pill pushers.
Yeah.
You go in and see them, it takes 5 minutes or 10 minutes, they give you another pill. They give you another pill.
CBD does
And it
more for
pays
me
to
than
stick,
anything else.
if you have to
I
have
was just
a
blown away.
medical
I was like,
doctor
I
stick
didn't
to
know
one.
that.
You know, it's when
Yeah.
you have people prescribing.
But
with
so
all my
often
different
plans
problems.
change and you can't
Oh,
stay
yeah.
with the same physician.
Oh, yeah, or they send this specialist or that specialist, and
Little mom?
I've just requested
My
that
daughter.
any
Yes.
specialist goes through my doctor, and my doctor's pretty understanding about natural healing, he's
Yeah,
from India,
yeah, for sure.
so I mean,
Yeah.
he grew up in a society where you can get
She
either
tried.
or.
And she was like, wow, I don't think
Something
it's
has
bad.
to change in our
She really
country
suffers from
politically
depression big
to
time,
get
a
the
lot of
research
trauma.
done.
So you get a mindset.
Well,
Just
really
thankful
strong.
we
You
have
believe
these
it, you know,
things.
Yeah,
so it's-
unfortunately,
it's-
we've got this
That's my
medical
mission for right now.
industrial complex that
Help her overcome depression.
is
Fibromyalgia,
so bought
and
into and so
it needs to
entrenched that it
be
cannot
healed from.
change.
Not for a while.
Her.
Hopefully more younger people coming up will
Make bad
push,
choices.
I don't know. But it is, it's
Super
a
pretty, so you can
huge
understand the
economic
scenario.
situation because of all of that.
And that's what drives them.
Really
So
helps.
often
Doesn't
I
make it
find
hard.
that something like this substance is really great, it's terrific, but they won't take it because it's not free, it's not on their pharmacy
Yeah.
card. And so will reverse, they'll take the antidepressant rather than taking this because,
It's not
it doesn't
insured,
cost
but
anything.
if it works and what you're taking isn't working, there really isn't much choice. I mean, sincerely,
Or you suffer through it, and there's no
Yeah.
sense in suffering.
that's it, and that's why I ended up with these implants, because I had real serious problems since I was a little kid. And, you know, it's just frustrating, cause that's not really covered either,
Mhm.
you know.
Right.
You
So
know,
much
most
of it.
dental, no, not serious dental work. Too expensive, they cover $1,500 and you pay
I noticed,
30.
uh,
You know what I mean, it's
Like
just
a
a
shift
little
in the pain or
ridiculous.
my
Yeah.
pain. I don't notice so much of a shift in the pain.
Good, other questions?
But in,
Yeah, I
in
do.
like,
So my
what you
grandfather, he
feel
has
or your
really
mind.
bad diabetes,
Oh,
and he
it
also
seizes
has
right on?
rashes all over his
And like, yeah,
arms.
went right
Do
into
you
the bloodstream
recommend for
for sure.
him to have the
Yeah,
gel
calming
and
for sure.
the dietary supplement as well?
Well, I think he should take the oral, because it'll have a direct impact,
What's my-
on his diabetes and his neuropathy.
You can blow the door
And
off.
it could also possibly clear up his skin as well.
Just taking the oral.
Yeah. But if you wanted,
Oh, I wish I could
you
get that.
could try, some of the gel on
They're freaked
the
out
skin,
by it. They think it's
that
like
as
a-
well.
yeah.
But I would get him started, on the BCP oral,
There you go.
to begin with, and then to consider, using the gel, if he got the benefits, and he got pretty positive results with it, then he could use a gel and he might see additional changes with it. So the rash could be atopic, it could be an allergic reaction, or it, could be I don't know, you know, and so it's difficult to say what it could be, but it's probably inflammatory, and it would correct, most of the time orally, but he could get faster benefit from the topical agent as well.
Okay, thank you.
Sure. Yes, sir.
We saw one of your CBD, cannabinoid, presentations 6 years ago, early on, I think, but do you have a biological theory on why our body is receptive to these substances?
Well,
Why, I mean, there aren't usually accidents in our biology. Why do these things work? in
Well,
our
there's,
system?
first of all, we have this endocannabinoid system, and these receptors are sitting all around our body. They're in our brain and throughout our body, and they are waiting for the signalings from other parts of the body to respond. But in that time, we also have dozens, and I mean dozens of plants that will connect up to these receptors. Curcumin, L-theanine, other plants also connect to this endocannabinoid system by their signaling molecules. And so there's all kinds of ways to modify this endocannabinoid system, make it healthy. And there's modifications in exercise, in sleep, and these all change it. And even our diet will change it. If we take an omega-3s, we will enhance our endocannabinoid system as well. So there's a number of different approaches to enhancing the endocannabinoid system, and these herbal approaches are also. Now, it just turns out that hemp has the largest number of beneficial substances, and it's been cultivated to really produce more terpenes and more cannabinoids, phytocannabinoids, that influence the body. And so it's as a result of these millennia of cultivation that we have found these particular benefits, and we've really accentuated the benefits of hemp. Now, but there's other plants that offer many of the similar ones. And for instance, beta-caryophyllene. So, you know, I talk about the endocannabinoid system, but that's a lead-in. I gave you a slide that showed all of the receptors that are signaled by caryophyllene and CBD. Well, there's a massive number, and there's other substances that can target that, and it doesn't have to be the endocannabinoid system. It can be other signaling properties. We've done that with drugs all the way along. But the drug industry tends to take one particular target, and they try to design a drug just for that receptor, and they fail. They succeed in making the receptor for the agonist for the receptor, but they fail in terms of side effects because you're not dealing with a full spectrum product. You're dealing with an isolated compound, and these isolated compounds have side effects, whereas you deal with a biologically herbal developed substance, then you get the balanced effects of the other substances that are in it. So that's why I always believe in a full spectrum product if it doesn't have the isolated properties that are available with certain terpenes.
Does it help with food allergies? Like, I'm lactose intolerant. Would it help me with like digesting lactose?
Probably not, but there's a lot of people who are sensitive. You know, lactose intolerance is really the majority of people are lactose intolerant. So you don't, after you're a child and after you grow up, you lose the ability to digest lactose, and you just don't make enough of the enzymes to produce it, to break down lactose. So it's a general category, and so if you're not having enough enzymes, then you're going to have a hard time making that, and that's a genetic factor, and so it's not going to be able to correct it. Now, if it was a food allergy, if a food allergy to something, then that could possibly be corrected if it was allergy. And now, for instance, I'm casein sensitive, so I can't take casein. Otherwise, I don't get an allergic reaction, but I get a food sensitivity. So I avoid milk and cheeses from dairy cows, but I can have goat cheese. Other questions?
I have kind of a silly one. What happens when a bottle expires? Does it just work less, or do we just toss it? I mean, I understand it depends on how long it's meant to expire.
You know, there's, the expiration dose says that it is not working at the full level of its performance. Now, how much of that is decreased or not, and so oftentimes there are arbitrary rules about, you know, you've got a 2-year shelf life.
Well, exactly.
For most substances, and they haven't really checked to see if it lasts longer than that. But the rules are that you put a 2-year shelf life on it.
Yeah, and it's a food, so.
Yeah, right.
Well,
And
it's not 2 years old.
But the marvelous thing about BCP is that it is antibacterial. It has all kinds of protective antioxidant, so it's going to have properties that's going to protect it in solution. So there's a good potential for it to be
And
sustained.
the other question was, and it's extremely safe for, say, a CDL driver?
Yes.
Okay.
It's absolutely, it doesn't contain any hemp, so it doesn't contain any THC, and so there's no risk
Should be
at all.
clear.
Absolutely. It's like, you know, eat your broccoli.
Mm-hmm. Exactly. I have
It's the same
somebody
thing.
I've been going head to head with about this, because it's just frustrating to see somebody suffering and that just,
You know, he could improve his vision. Now, vision is a big deal in
Oh, yeah.
CDL drivers, and they get tired eyes. And he could improve his vision and decrease his tired eyes
At the same time.
completely with it. Yeah. And
Well,
all
he's
he'd
gonna-
take 1 dose and he'd find out.
that's it. Well, he's gonna get them on whether he likes it or not.
They don't listen well.
They don't.
That's still better. The biggest is if it gets hit this way, but even then it started.
Hey, Michael?
It's a side.
What happened?
There's a decrease in the pain. It's mainly like most of these tendons were gone, so it's this side holding it together, and like so this direction here is generally a lot worse pain. It's probably cut by 35-40%. So
Oh, good.
and I can actually
You can move it.
so that from here out is, I mean it's pretty manual. I mean home medicine you're only going to get so far. So, but it's yeah. I think I could like just swim in the stuff and then go to work.
There you go.
For sure.
I've had those requests.
Or the gel.
I've had the request for getting gallons of it. and-
No, I think it would be super beneficial for me. I think it would be across the board, considering my past, just for mindset alone and like what we deal with every day, just in general life. It would give you the feeling I got when I took some of it, and I took my daughter. She suffers with depression. I had her take 3 drops of it last night, and it was like, I can't remember, it was 10 or 15 or 20 minutes. What is half hour? Well, how do you feel? And she goes, I don't feel as depressed. And this is coming from an 18-year-old that's been through tons of trauma. She sleeps all the time. Just an obvious case of depression. So, yeah, so it helped her immensely. And it'll
And you
help her.
save that till after. You save that comment until after.
Oh, no, it'll help her immensely. It'll help pretty much anything. My wife is kind of going through the menopause thing, had the real bad thyroid. They had her on seizure medicine, and it was insanity, and they finally got all that fixed up. So I'm thinking this stuff would help rewire. I finally talked her into trying CBD. She was real paranoid about it, and I said, well, you can see the difference in me. I'm not a screaming, yelling, cussing orangutan anymore, so CBD's helped me with that, right? So maybe it'll help you. So this stuff, though, I think that will bolster our medicine case a little bit. So it's just anything to make your quality of life. You only got today, you know. So if you can make the quality of your life so much better, it's worth
Yeah, and
everything.
you'll learn from it. You'll sample it. You'll find out what the best time to take it
Totally,
is.
yeah.
You find the right combinations. You may want to rely on one versus
Yeah,
the other,
yeah.
and just play with it and use it topically, use it orally,
Yeah.
and you can explore.
I seen some results in her. She's pretty extreme on the trauma part. Like if a 10 was extreme, she'd be a 9.5 as far as trauma. And so seeing the difference in her after she took those drops, even like the shape of her face, the onset of her eyes,
You've noticed.
oh, it's amazing, man. Yeah, I
Yeah.
know. And that red stuff, and it's not rosacea. There's another name for it. It has something to do with your ovaries, and it was like less. And I was like, hey, check this out, because she had one of those cysts that'll grow from emotional trauma, burst, and she thought she was dying, and so she wouldn't go to the doctor either, right? It runs in the family, I guess. But she said, yeah, I feel like I'm dying. I said, well, you go to the hospital? No, she's scared of the hospital, and I am too. Anyway, so she kind of suffered through it, but we've done some other stuff to help her with that. But going back to the stuff though, after she took those drops, I was just like, and she's like taking selfies, going, I can't believe this. So to me, it's worth $1 million. I mean, I'd cut the rest of my finger off if I had to get them all. It's that good. So, you know how it is when you love your kids, right? And I suffered with depression for like 15, 20 years, whatever it was. So, I'm stoked. So,
That's
I hope
great.
I hope they don't take you away.
Yeah.
Big brother, right? He comes and
Nice.
Thank you so much.
How did you stick your ringer back on?
By hand. I didn't realize how bad it was. First aid, my partner was there, my fallen partner was there, we fell timber, and I pulled it down to see how bad it was, and the whole thing just kind of fell off.
Mhm.
And it's weird how it cut it right around the joint, so when it fell down, there was a little strap holding it on the bottom. You could see the socket, so I just rearranged it and splinted it and taped it, and what are you gonna do?
Super glue?
Well, I didn't know what else to do. I just thought, man, I don't want to lose this. So we just, and so, yeah, it's actually doing pretty well.
Wow.
I think I can put some KT tape on it and make a tendon so it'll come back, and luckily it's not my right finger. So,
Well, that's great, Mike. I really appreciate
awesome
the
product, nice
information.
presentation, man, for sure.
Thank you.
I clapped, but it hurt, so. Finger fall off, right?
That's terrific. Thank you so much for attending and
Thank you.
listening, and
Awesome.
we appreciate the feedback on this.
Thank you. Super cool.
It's, can I ask you a question? It's not polycystic disease, is it? That.
My daughter?
Yeah.
I forgot what we go to a naturopath, Dr. Michelle.
Yeah.
She told us what it was.
Yeah, we need
I
my
can't remember.
yeah.